Thank you so much for joining us today. We know that health and safety has been at the forefront of our thinking as we've developed our plan for Stanford Public Schools. And so I am so excited to have our health professionals here with me today to answer some of your questions and to really go over general information about health and safety as we begin to implement and enter our school year. So I'm going to start with everyone introducing themselves. So we'll start with Dr. Yoon. Would you like to introduce yourself?
Hi, my name is Dr. Henry Yoon. I'm the medical advisor for the City of Stanford and Stanford Public Schools.
I'm Dr. Asha Shah. I am an infectious disease specialist, and I'm the Associate Director of Infectious Diseases and Hospital Epidemiology at Stanford Hospital.
I'm Jody Bishop-Pullen, an Acting Director of Health for the City of Stanford Department of Health and a public health professional.
Hi, I'm Patricia Caldwell. I am School Nurse Supervisor for the City of Stanford Department of Health, and I supervise the school nurses in the City of Stanford.
Well, thank you all for joining us here today, and thank you for all of your input as we've developed our plan. Your insights and thoughts and feedback has been very helpful. Thank you. So we'll go on to the first slide, Dr. Yoon.
Great. So the first question, or the first slide, talks about the hybrid model and its safety, and I'm sure that's on the minds of lots and lots of people. I think what's great about this question is it gives me the opportunity to talk about the three primary tenets in public health, the primary mitigating strategies that we use to try to combat the spread of the coronavirus. And when I say mitigating strategies, I think it's helpful to think of those as really, what are the things that we're doing to try to prevent the spread so that we don't get sick and that we don't get other people sick? And again, those three primary strategies are the things that we do. You've heard time and time again, the idea of social distancing. And really, the reason that we're doing that in schools the way we are is reducing the capacity by at least 50%. So the idea being there, if there are less students there, they're able to maintain that safe distance. The second thing we talk about is the idea of wearing a mask, right? And we've all heard how important that is as what we call source control. So when you hear things about source control, it's, again, things that we can do or mitigating strategies to try to prevent the spread, and wearing a mask is a key part of that. And the third primary strategy that we use is the idea of hand hygiene, good hand hygiene. Again, the idea of washing our hands, avoiding touching our face, and spreading the disease again, giving it to ourselves or to other people. And because we're able to develop a plan to include at least those strategies, we feel that it's safe to bring students back in this hybrid model. Again, the idea of balancing these strategies in many, many different ways. Dr. Lucero has spoken about the idea of adding layers to reducing the risk. And because we're confident that we've been able to do that, we feel that a hybrid model is going to be a safe way of bringing students back at this time.
Thank you. Oops, sorry, my mouse is going quicker than I'd like it to. There we go. Oh, no, it keeps going quickly.
well, once you settle there, I know this slide's going to talk about, there we go, some of the COVID-19 symptoms. And, people have heard of the symptoms, many, many symptoms. But I think some of the important ones are going to be the idea of fever. And the way that we define fever is 100.4 degrees Fahrenheit. You're looking out for things like chills, new cough, shortness of breath, or difficulty breathing. Everyone's heard this idea of a loss of taste or smell. and the idea of having a sore throat. And again, these are just some of the COVID-19 symptoms. A full list of symptoms can be found on the CDC website. If you just go ahead and put in your search engine the idea of COVID-19 symptoms, it'll give you an exhaustive list of symptoms. And again, really broken down to some that are more common and ones that you really need to be focusing in on. So many people have probably heard this idea of a close contact. And in epidemiology and in public health, the CDC has defined a close contact as someone who's spent at least 15 minutes within 6 feet of a person who's been infected with COVID-19. And the reason they've done this is the science shows that if you spend a prolonged period of time within a close distance, it increases your risk of transmitting the disease or catching the disease if the person has an active infection with the coronavirus. Along those lines, another way that close contacts are defined are if you've had direct exposure with someone who's infected or possibly infected with droplets of saliva or nasal mucosa, meaning if someone coughs directly in your face, or you've come into contact with someone's sort of saliva, and then again infect yourself by touching your face, your nose, your eyes, your mouth, which is exactly why we talk about again good hand hygiene to be able to clear the infection off your hands, and then again trying to avoid touching your mouth, your nose, and your eyes. So another term that people may hear of is this idea of contact tracing. And contact tracing is a public health intervention or a tool that we use in public health to try to get an idea of who's come into contact with who. Because the idea is that if we find someone who's either highly suspicious or a confirmed case of COVID-19, all those people who have come into close contact, which we defined a little bit earlier, are at increased risk of developing that infection. And so the idea of contact tracing is the process by which we try to identify those people. And if we can identify those people who are close contacts, we can warn them. And we can warn them and tell them, hey, look, you know what, you should quarantine yourself. And we'll talk a little bit about what that means in a couple of slides. But again, the idea of contact tracing is to try to help stop the spread by finding people who are at increased risk and telling them, hey, you know what, you need to be looking out for these symptoms and you need to separate yourself from others so that in case you get sick, you don't get them sick. Now, two terms that you've heard a lot about, I'm sure, is this idea of isolation and quarantine. And I think what's important to remember is that what you're doing for self-isolation and quarantine are very, very similar. The reason you self-isolate and you quarantine is some of the difference. So when we talk about putting someone in isolation or self-isolation, these are the people who are sick, who have been identified as infected and have these active infections that could spread to other people. And so when we say that you need to be isolated, we recognize that you're sick, that you have a positive test, or that you're highly suspicious that you may be positive. And the idea of sort of separating you from other people so that you don't get them sick too. And so how long you have to do that depends on how long you're sick. And so one of the definitions that we use is that you need to stay home and away from other people for at least 10 days since the onset of the symptoms. And at least 24 hours have passed without a fever, without taking any what we call fever reducing medications, things that we use to reduce fever. And the third component of that is improvement of the symptoms. So at least 10 days, at least 24 hours without fever reducing agents, and improvement of the symptoms. But I think what's really important as well is to keep in mind that if you are infected with coronavirus and have COVID-19, that you need to connect with a medical provider, because we don't expect you to go through this alone. And that's why the clinical providers are out there to give you guidance, because it may not be 10 days, it may be longer. Your primary care provider knows you the best. They may know your medical conditions and any risk factors that you may have. And so these recommendations and guidance may change. So it's really important for you to connect with a medical provider early on. So self-quarantine, again, was the other component. So we quarantine those who are not known to be sick, but are at risk for being sick. And because of that, we ask that people who self-quarantine stay home for 14 days since the last exposure to whomever it was that was infected with COVID-19. And so a lot of people wonder, well, what's the difference? It's 10 days and 14 days. And I won't get too bogged down with details, but the idea of the 14 days is really the idea that it's during that time you could very well develop the illness, develop COVID-19. And so the science shows that it can take up to 14 days. And so that's the reason why we ask people to quarantine for 14 days. Now, if in that 14-day period, you're unlucky enough to start developing symptoms, you should be tested. Again, you should already be in contact with a medical care provider. You'll be tested. And if you're positive, you will then go into, again, isolation. And that starts the clock again for at least 10 days and all those things that we talked about in the previous slide. So one of the questions that keeps presenting itself is, and it's a very good question, is what happens after a positive test in school? You know, people are wondering, well, how are we going to know? How are we going to find out? How can we protect ourselves? And it is so important, and it's been one of the biggest priorities for Dr. Lucero and her team, is that they want to make sure that they're communicating in a timely manner, accurately, and again, providing the kind of guidance that all of the citizens of Stamford need when it comes to a positive test in a case. So the three things that we can tell you, and again, I don't want to get into too many details at this point, but the idea that if someone tests positive, it's very important that they contact either the school nurse or the school administrator. And so families and students should contact the school nurse. Teachers and staff should really be contacting the school administrator as really the best way to bring in this information. Now, the team that's going to be working to communicate and to do an assessment obviously is going to involve both the school nurses and the administrators and central office and the health department. But we find that it's going to be important to identify point people so that this information gets in quickly and accurately. So the next step that happens once someone, either school nurse or administrator, is notified there's a positive test, it's what we call the risk assessment or contact tracing. We talked a little bit about contact tracing a couple of slides ago. But what happens at that point in time is we need to start collecting initial information. So school nurses, in collaboration with building administrators, need to start finding out, well, what is their class? You know, what classes were they in? Who did they come into contact with? And so that information really needs to start being collected as soon as possible and in a coordinated fashion. And that's the second thing that's going to happen. And then, again, as that information is being collected, contact tracing begins in terms of identifying people who are at risk so that we can move on to, again, to step 3, which is the notification portion. So the health department's involved, central office is involved, your building administrators are involved, your school nurses involved. And at that point in time, we need to get a message out to everyone, or we need to get a message out to those people who are going to be at risk so that we can give guidance as to what to do next. Right? And so what we can't do is we can't share, and I think everyone would appreciate this, because we have to maintain a certain level of privacy. If you were sick, you might not want everyone, or people who don't necessarily need to know that you're sick. But we want to make sure that we communicate to everyone something, while at the same time balancing that with privacy. So we talked about in that second step the idea of a self-assessment. And what I'm going to do is, when we talk about self-assessment, it's the idea of looking at the most common risk factors, the common symptoms that we talked about earlier on, and some of the additional risk factors such as travel, again, symptoms, contacts, things like that, and putting that into a tool or a set of questions that's easy for people to use. Because we're constantly going to be updating these things so that parents and students and staff and teachers know what it is that they should be looking out for. And one of the tools that we're going to be used for self-assessment is this idea of a checklist. And the checklist that we're going to be putting together, again, includes these different elements. This isn't exactly the checklist because we're constantly modifying it. We want to make it simple. We want to make it usable. And so, but it will include things like symptoms and a checklist of, do they have the symptoms? Do they not have the symptoms? And what to do if they have those symptoms. They're going to ask about things like contacts. Have you come into contact with anyone that you know is sick? Any family members, people outside of the family? And again, the idea is travel. Have you or anyone close to you traveled into hot zones or things like that? And again, that has an impact. And finally, one of the things that we're going to make sure that we include in this checklist is a reminder, is a regular reminder that your students, your children, this is all new to them. This is all new to all of us. And so we need to make sure that we're supportive, and we remind them every day that we're there for them and that we're going to help them. And we're all in this for them to be successful, for everyone to be successful. And so that's a key point of the checklist that we're going to make sure that we give a reminder of. And so I think we've got some other questions that I don't want to take up the whole time, since we have experts in all the fields. So I think we have a number of questions that we're going to go through as well.
We do. Thank you so much, Dr. Yoon. That was very informative. Oops. Here we go again. All right. So first we had lots of questions that had to do with masks. So I believe Pat is going to share with us what's the best mask for a staff or a student.
Yes, hi. So this has been a big question. You hear a lot in the news, about wearing the mask, and the saying that the best mask is the mask that your child or you will wear is definitely important, because they do need to keep that mask on while they're in the school building. With that said, there are some additional information about the mask. So you want a mask that is at least a couple layers. You'll hear 2, 3, or 4 layers, but you do need one with a couple layers, one that will fit over their nose, over their chin, mouth and chin. And the best one for keeping it secure are the ones that have the ear loops, that you can loop it right over their ears, and it needs to fit loosely but not falling off. So again, the best mask is one that will keep on. There's a lot out there. There's a lot ones with different colors, different textures, and the other idea that we've had with students, especially the little children, is maybe to start getting them used to wearing that mask at home for a little bit of time, so that when they are in school and they are expected to wear it for probably more time than they've had at home with it on, that they'll get used to it, so that it's not new to them. And again, change it. If you're not wearing a paper mask, a cloth mask, you should also wear it once a day. That should be laundered once a day. It shouldn't be something that you're wearing 4, 5, 6 days in a row. It needs to be clean.
Can I just add one more thing about the masks? That masks with valves should not be allowed because the valves don't protect others from the wearer's germs. So the point of wearing a mask is to protect other people from the wearer, but the infectious particles can escape through that valve. So children or staff should not be coming to school with valved masks.
Thank you for the clarification. So a big question that's asked all the time is, what determines if SPS moves from a hybrid model to a full distance teaching and learning model? And I think that I'll walk through that question because I will spend a lot of time thinking about that as we progress into the new year. So of course, I will be looking at the new cases in our area. And what's wonderful is the Department of Public Health will be putting out that information to us by county each week. And then we also are going to look at some secondary indicators, and that's things like how many new people are hospitalizations do we have? How many new percentage of positive rates do we have in our area? So that's going to be really important. But above that in Stanford, we're going to look at some other things because we've created these wonderful plans, and we know that right now they work on paper, but when we enter back into school, we really want to check in with our building staff to make sure that they are all able to be implemented well. So we are going to try to figure out, once students are in school, are we able to actually social distance? And if we're not able to social distance, we may have to make a different decision about whether or not we'll be able to remain in school. Are we able to move indoors and outdoors comfortably as a students and staff? So think about when we start towards arrival and dismissal. We have a lot of students going into a building and a lot of students leaving a building at the same time. We want to make sure that we're able to comfortably move students in and out of our buildings. We will look at lunchtime, whether or not we're able to truly social distance during lunchtime, and we will look at how our cohorting, especially at the elementary school level, is working. We want to make sure that our ventilation systems are up to par, and so we will be checking those out on a regular basis. And finally, we'll be doing some assessment on our cleaning to make sure the protocols that we put in place are actually working. So these are things that we're going to ask principals to work with their staff to provide us with feedback so that we know that the things that we have put in place as part of our plan are actually working. So our next question has to do with, if one person in the building tests positive, will the building close and be closed for deep cleaning? And I think, Jody, you're going to answer that question for us.
Yes. So the important thing to remember here is the information that we've gained from doing the risk assessment and other information that we have will determine the procedure, but also knowing that, as Dr. Lucero mentioned, that there are very specific protocols to be followed, recommended by experts in this field of cleaning and disinfecting facilities, and that though in terms of how often, what types of products to be used, the correct use of the products, and there will be very targeted, frequent, thorough cleaning that will happen, and especially if there is positive or other problems that happen in the building. But there is very specific protocols that are put into place.
Oops, here we go again. Is it necessary to deep clean every day?
Well, it's very necessary to thoroughly clean every day, and that is also part of the plan to ensure that the cleaning is done every day and throughout the day, based on the protocols that we are being told to follow.
Dr. Shaw, I think you're next. And should students and staff wear gloves or other protective gear?
So we definitely don't recommend regular use of gloves outside of the healthcare world. This tends to make people feel that they don't have to wash their hands. And hand hygiene is of the utmost importance, as Dr. Yoon talked about in the beginning of the presentation. So we do not recommend that children wear gloves. We do not recommend that staff wear gloves. In terms of other protective gear, I think that this is most applicable to the school nurses who should be wearing personal protective equipment when they take care of children, especially those children who are sick. So this includes wearing eye protection, perhaps wearing a gown, also wearing gloves if they're taking care of these individuals. Eye protection in general is not recommended for the general public. It is recommended for healthcare professionals when COVID-19 transmission is moderate to high in the community. And so again, I think that's why it's most important for the school nurses to wear eye protection. For those individuals and staff members that are providing very close type of contact instruction to children, so physical therapists, occupational therapists, for example, those individuals may want to consider wearing eye protection as well due to the nature of the type of work that they do.
Thank you. What if a staff member or a student travels to an area with high transmission rates?
So Governor Lamont put into effect an executive order in the end of July, basically making it mandatory for individuals who travel to states that are considered hot zone states, so states with a high case positivity rate, are required to self-quarantine upon return to Connecticut for a period of 14 days. This is regardless of testing in the state of Connecticut. And this is another risk mitigation strategy that's being put forward by the state, realizing that New England and Connecticut is kind of one of the very few areas of the country that's doing well in terms of COVID-19, which is why we can get our schools open safely. So faculty or students, families who travel to these areas are required to follow the governor's order and stay at home for that 14-day period of time. For students, they will have the opportunity to e-learn during that period of quarantine, so they won't necessarily, skip a beat in terms of their academics, but it is something that needs to be taken seriously in the state.
Thank you. Oh, this is a really, this question comes up probably more than any other. Pat, can you take this for us? Can kids safely play outside without a mask?
So yes, there's a couple thoughts on this. If the children are outside, whether it's for play or gym, they can have the masks off as long as they can safely maintain that 6 foot of distancing. And this is where teachers and will come into play to make sure that the children are going to be able to maintain that lack of closeness, at least the 6 feet distancing. It's an opportunity for children to get a little bit of a mask break if they can. But if at any time that becomes a problem or that they feel that they can't keep the children apart, because as young children, they're going to want to be near their friends. They want to hug. They want to be there. And if that's happening, then they really do need to keep their mask on. The other important thing about masks taking off outside is what are you going to do with it? You don't want masks to be just put on the ground or hanging from, the tree branch or something. So if you are going to let the children have mask break with recess, there needs to be some understanding of what you're going to do with that mask prior to taking it off. Because you don't want people having them putting on a dirty mask that's been on the ground, or picking up somebody else's mask and putting it on. But this also, like I said, goes along for gym too. If gym is outdoors, if the children can maintain that safe 6-foot distancing, then it is okay. But if not, then they need to keep the masks on.
Thank you. And that's really good thoughts for us to start thinking about, where would a student keep their mask? Is it in their pocket? Where would they keep their mask? So thank you for bringing that up.
They do. Can I just bring up something? As being a parent of young children, they have those necklaces that people have their glasses on, that they do make
Like a lanyard.
for masks.
Mhm.
So, I mean, I'm thinking of getting those for my kids for school. So it's just something that parents can think about purchasing to try it out. Then the child's mask can kind of hang around their neck, and you don't have to worry about them losing it or picking up someone else's mask. Just an idea to throw out there for parents.
Thank you.
And I'm just going to add, again, just a reminder that it's not just when children play together at school. There's nothing inherently unsafe at school that's not unsafe in the community. So, I think we have to remember that as well, that those same rules apply to kids when they're at home.
That's a great point. How often should we take mask breaks?
So mask breaks are pretty much going to be individualized by classroom or age group, the temperature outside. Some of our buildings are not air conditioned, so to wear that mask for 6 hours a day is going to probably be a little hot. So I think it has to be more of a judgment call on the teacher with the age of the child that they're teaching. But we all want a mask break. I can tell you there are many times where I've been in meetings for 2 or 3 hours, and I'm glad to get back to my office to take the mask off because there's nobody else in here. So I think we need to just be cognizant of how long the mask has been on. I don't think there's been any specific time frame we should take the mask break every hour, every 2 hours. I think that's going to be left up to the teacher, the adults, and the weather outside or inside, so that we can safely still keep our distance. If we're going to take the mask off is most important. If you cannot maintain that distance, then it's not the appropriate time to have a mask break. Or we need to maybe go outside where they can be 6 to 12 feet apart in order to just get a breather. And we'll all get a mask break when we have lunch.
So the last question is, what does a mask break look like? And I think as educators, we always try to create something that our students can remember. So for some of our older students, I think that going over and turning off the light so all attention is drawn to the teacher and everyone is seated in a seat, and then you can decide that it's all time, we'll all take off our masks. It's really important that a lot of talking isn't being done when that mask is off our face. And so for our older students, it could just be as simple as getting everyone's attention, make sure everyone's seated. And then when the mask break is over, maybe we turn back on the light, all of us put back on our mask, and we get back to work. But for our younger students, you may want to say something like this: feet on floor, bottom on chair, hands in lap. Ready? We're going to take a mask break. We take off our mask. We are quiet, but we're not going to touch our face because that's not safe either. So we're quiet. Okay, now the mask break is over. Let's put back on our mask. All right, make sure it's over our nose and our mouth. We're ready to get back to work. So teachers have very creative ways to encourage their students to take mask breaks. So let's see if we can come up with some creative ways and share them with one another across the district. So that's the end of our formal questions that we have. Did anyone want to share anything before we take off for the day?
I just wanted to,
oh,
go ahead.
go ahead. Well, I just wanted to kind of piggyback on what Dr. Yoon said about what's right for school is also right when we're not in school, and that's really important from a public health perspective, that we keep each other safe when we're in the community and other places, not just in school, so that what we're learning to do in school and trying to do in school can really be applicable and good practice for wherever we are. And I think that's important for all of us to remember.
And very similarly along those lines as well, you know, I think some of the techniques that we learned from school, you know, as you had mentioned, that we can bring home, something that Dr. Lucero had pointed out before is this idea of sort of reminders and messaging and signage. I know that we're going to be putting a lot of signs and reminders in multiple places. You know, it's these small little reminders that are going to help reinforce these good habits, so that at some point in time, hopefully we won't, you know, we won't need as many reminders, and we'll still be practicing these habits. But, you know, signage, reminders, you know, all those sorts of things are going to be really important. We're all going to have to keep ourselves accountable. We're going to all have to be responsible for educating each other. And I think if we're able to do that, you know, we'll be in good shape.
I also just want to say how important it is to talk to your children and really explain to them that school is going to look a little bit different, but why these things are important, like why those 3 tenets are important: washing your hands, wearing your mask, maintaining distance, and really starting to practice that if you haven't done so already. I think it's a way that you can explain it is to say that these strategies, or taking these things seriously, is what's going to help us try to keep school open all year, right? Nobody wants to stay at home, and again, right, all these kids love going to school. I think that this is what provides the best chance for things to be able to run smoothly and safely. And I think as parents, speaking as a parent now, I think we just have to be flexible this year. I think we need to just roll with the punches and understand that things can change, but at the end of the day, we're trying to keep all the students and the staff safe, and keep the community safe. And so I think that that's something that's really important to kind of remember as each week goes by, you know, once school starts.
And if I could just add also that the other important role that parents will play, and I've seen it a lot with my 2 grandchildren when they do come to visit, it's all about how we present it to the children. If we're uptight about it and we're anxious and we're nervous, then we're all going to have some level of anxiety. But, you know, my little 5-year-old granddaughter will say, "Grandma, you need to put your mask on if we're leaving the backyard, because I don't think I can keep you safe." You know, so she's already learning, and she sends me pictures of her screen time is mask time, and she's practicing wearing her mask. And even the 2-year-old will say, "No, Grandma, we have to do air hunt right now." And they're learning some simple language that is going to be good for when they do go to school. It's trying to create a more relaxed attitude about it, so that they're not feeding off of our own anxiety.
Well, thank you so much for your time today. This has been very informative, and I am excited about starting the school year and putting these good practices in, these good strategies into practice. So thank you so much. Take care.